My name is Zoua Vang. I'm an associate professor of sociology at McGill. I'm also the founding director of the Indigenous Maternal Infant Health and Wellbeing Lab, which basically supports my work and outreach efforts on perinatal health with Indigenous communities. In terms of experiences of everyday discrimination, we find that Asians tend to have very low self-reported rates of discrimination. So there's a kind of racial hierarchy, if you will, in not necessarily actual experiences of discrimination, but willingness to ascribe an event to discriminatory actions, right? So you typically have, Indigenous and Black populations reporting more experiences of discrimination, typically followed by then, Asians, and then, Muslims and other groups. And so, if you were to take those statistics at face value, right, and assume that it's actually reflective of people's real discriminatory experiences, you would walk away with the conclusion that Asians in Canada actually are doing quite well. They don't have a lot of exposure to discrimination, and so there's no reason to worry about what's happening to that population, right? But there's lots of other factors that feed into why an individual may or may not report something as discriminatory. So we know, for instance, that there's quite a bit of underreporting in these kinds of questions about experiences with discrimination, and not just with Asians, but with other racial ethnic minority groups as well too, right? And so there may be concerns about, why if I report that I'm just have been discriminated against, for instance, or that there's racism in this country. If I'm a new immigrant and I'm still waiting for my permanent residency to kick in, or I'm applying for citizenship, I may have fears and concerns that those kinds of information may potentially affect my applications, right? Not that it actually does, right? But those are the kinds of fears or concerns that individuals might have. Or also there's also some real cultural differences in people's willingness to talk about hurtful events in their lives, right? And so some individuals may not necessarily feel comfortable talking about racist incidents where they were the targets, because it could be quite traumatic for them. In that paper, we do say that underreporting may be part of the reason that we see low rates of discrimination for Asians. But it could also be that the nature of the questions, right? So if you're asking about a global question, like have you ever been discriminated against at the airport? Okay, for Asian Canadians, that kind of question may garner very low responses of no. But if you're a Muslim, you might actually have very high response rates for that, right? If you were to ask the question now, have you ever been mistreated because of COVID-19 or fears around COVID-19? You'll have a very different answer than, say, a question like, have you ever been denied promotion, for instance. So it depends on the questions that you're asking, and it really depends also on the kinds of political environment that we're in at the moment too, right? That influences these kinds of questions. So they tell us these kinds of survey questions tell us something about discrimination in society, but we also have to contextualize them in order for it to make sense. So if you find a high rate response rate or a low response rate, it's tempting to walk away and say, this group is particularly hampered by discrimination in society, or this other group is, not affected. But in order to make those conclusions, you need to actually look at the larger picture, how those questions were asked, in what context, in what political environment. growing up second generation as racialized in places like Canada and the United States, you expect to be a member of the society. You expect to belong from the get-go because obviously you do, right? You are a member of the society. But when you are reminded and treated as an outsider by others through discriminatory racist acts, then that kind of external assault on you is interpreted and lived in a different way than, say, if you were an immigrant coming from another society with another frame of reference, with perhaps expectations that, yes, there's going to be challenges in the host country. And so when you encounter those host challenges, you don't feel as though you are attacked in the same way because you are an outsider to some extent. So you have that expectation that as an outsider, I need to still prove myself in some ways and work towards integration, right? And so I think these generational experiences and differences and these different frames of reference and expectations are then what leads to some individuals, especially the first generation, being less reluctant to call an encounter as racist or discriminatory. It doesn't mean that they don't think or know that it is. They just won't say that it is, right? Whereas for a second generation immigrant, they're more likely to call it out and attribute it to racism or discrimination. I don't recall any information specifically on mental health of Asian Canadians, but there were questions about perceptions of safety. So one of the questions that were asked of participants was whether or not their perceptions of personal safety in their neighborhood had worsened because of COVID-19. And the results show that Chinese, Korean, and South Asians had increased, were among the three groups that had the worst fears related to being harassed in their neighborhoods, specifically because of COVID-19. And so that kind of data confirms some of the anecdotal messages that we're hearing from Asian communities around Canada in terms of actual increased anti-Asian discrimination or racism specifically related to COVID. I think both could be happening, right? So you could still have underreporting of racist attacks and racial incidents prior to COVID-19. And at the same time, you could also have more cases because there's actually more activities going on, right? More racist incidents because of COVID and the fears around COVID, but also you could also be seeing the spikes in the numbers because more people are willing to talk about it and coming out. And so the underreporting is less, right? So you could have both actual incidents rising and then also less underreporting, which then drives up the numbers altogether. And both are quite plausible. I think that not just in the particular situation with COVID-19, but in general, Canada does not have a strong history of collecting data based on race, right? So other than the census data, we don't have, for instance, detailed health information or other kinds of public information, like even vital statistics, like birth, death records. We often don't have information about the person's race or ethnic background. We know, for instance, if they're foreign born, and if so, where they were, which country they were from, and we can infer from that race ethnic background, but we don't actually have information on their self-reported racial ethnic identity, right? And so the kinds of calls that we have been seeing around Canada from different communities wanting these kinds of race-based data is, I believe, rooted in the belief that such information is necessary in order for not only the resources, the targeted resources going to those communities most in need, but also to fully understand the breadth of the problem, right? So we always look to the United States, where we see really high rates, disproportionate rates of COVID infections among Black and Latino communities. And here in Canada, we don't have any kind of comparable sense of whether or not certain communities are disproportionately affected. We know that some are, right? For instance, recent immigrants are disproportionately affected in terms of their exposure to potential COVID, because they are typically the ones working on the front lines or the necessary essential occupations. There's some evidence coming out of places like Toronto, for instance, that Black Canadian communities are disproportionately affected by COVID. And here in Montreal, we know that, North Montreal, for instance, is an area that's disproportionately affected. But those are very piecemeal information, and we don't have any national perspective on these kinds of potential racial disparities or ethnic disparities in COVID-19. Having such information is vital for public health campaigns, right? And to get the resources to the communities that need them the most. We think about right now how COVID-19 could leave these lasting physical health problems for individuals who caught the virus. So there's this real direct health component related to COVID, but there's this indirect component of health related to COVID too. And that's through this mechanism of racism and discrimination that certain populations like Asians are experiencing during the pandemic, right? And the reason why I say that they could be potentially long-term is because we know already from established research that there's a strong connection between discrimination and racism and poor mental health outcomes, and even poor physical health outcomes, depending on the indicator that you're looking at, right? And the reason behind that is because individuals who are exposed to discrimination or who experience racism and discrimination on a pretty much daily basis, their stress response is fundamentally different than somebody who doesn't experience that, right? And if you think of the average human as having a basic level of functioning, of resting, functioning like around here, right? Somebody who is constantly exposed to discrimination or racism, their functioning level is constantly up here. And what I mean by functioning level is, I mean in terms of their regulation in their body for external stressors, right? And so if you are constantly experiencing stressful stimuli like discrimination, okay, you never fully go back to your normal, natural resting state in your body in terms of stress regulation, right? You're always up here. And so being always up here takes a wear and tear on our physical body, right? Even on our organs. And so that's why we know from research that people who experience discrimination and racism have higher risk for cardiovascular disease, higher rates of hypertension, higher rates of other kinds of chronic diseases because of this internal process of wear and tear that happens, that is at the interface of these social factors that we know, like discrimination and racism, but then gets embodied physically in our systems, right? And that changes the way that our organs and our bodies function. And we can look to history to give us some lessons. Like, for instance, Asians have also been scapegoated in the past with the yellow peril, for instance, right? Immigrants certainly have been scapegoated at different time periods. And so it's not new. I think what is new is the kind of, again, like how long is this going to last, right? We know a vaccine is on the coming our way. Would the introduction of a vaccine and mass vaccinations necessarily mean the abatement of anti-Asian racism related to COVID because the pandemic is now under control? Or do we see, a real transformation in society such that, Asians will always be suspect now, right? we hear talks all the time in the media about the coronavirus is the latest pandemic, but there's another pandemic right around our doors, right? And a lot of these, at least the media narrative, links these pandemics to the cultural activities of certain populations, like the wet markets, for instance, right? And so, there is the potential that the kinds of anti-Asian racism we're seeing is not just a temporary phenomenon, but may actually stay around for quite longer. The intensity of it may fluctuate depending on actual pandemics and outbreaks, right? But there's always going to be now that underlying current of suspicion of a particular segment of the population that is, potentially releasing, if you will, like a disease upon human population, right?